Card of the Asplenic patent. Introduction. Congenital asplenia is rare. The extent is unknown. Is uncommonly underdiagnosed. Study in neonates with cardiac malformation describe the association with asplenia up to 3%. The diagnosis of congenital asplenia is difficult and requires a wide index, and the sample size are rarely recognized can change the morbidity and mortality associated with this condition. The presence of a small splenic function is a reflex in decreased clearing of antigen, both extracellular and intracellular, and a decreased response to the antigens, and the alteration of bacterial pathologies and reduced lipid property and foodness. Cause. The functional asplenia is due to cause as diverse as sickle cell anemia with repetitive stroke, autoimmune disease, inflammatory bowel disease, chronic hematogen, and atrophy of the splenic arterial thrombus.
Streptococcus pneumoniae, or pneumococcus, is a type of gram-positive bacteria. It can often be found in the upper respiratory tract of humans, but as with many natural flora, it can become pathogenic under the right conditions and cause pneumonia, paranasal sinusitis, and meningitis. Until 2000, Streptococcus pneumoniae infections caused 100,000 to 135,000 hospitalizations for pneumonia, 6 million cases of ear infections, and 60,000 cases of invasive disease, including 3,300 cases of meningitis. Disease figures have improved since a pneumococcal conjugate vaccine was introduced in 2001. Streptococcus pneumoniae is spread from person to person by the inhalation of respiratory droplets from an infected person. Persons at higher risk for infection include the elderly, children under 2 years old, blacks, American Indians, and Alaska Natives, children who attend group daycare centers, and persons with underlying medical conditions, including HIV infection and sickle cell disease. The incidence among young adults and young children is decreasing due to improved HIV therapy and to the use of the new conjugate vaccine for children. Outbreaks have occurred in institutional settings and child care centers. In the United States, beta-lactam resistance is common, and the prevalence of strains resistant to multiple classes of drugs is increasing. Death occurs in 14% of hospitalized adults with invasive disease. Neurologic sequelae and or learning disabilities can occur in meningitis patients. Hearing impairment can result from recurrent otitis media. These are just a few things to know about Streptococcus pneumoniae disease. To learn more about environmental infectious diseases and pathogens, or indoor air quality testing services and prevention measures, please visit the website shown on the screen.
Asplenic. Often this infection, particularly those caused by is pneumonia, have a formal course of mortality rate reaching up to 5%. It has been estimated that the cumulative rate of developing of field lung infection of 5%. It is hinted in children under 5 years of age than in adults, and hemoglobinopathies here that involves traumatic splenomy. It is important to note that in later situations, the more episodes of sepsis usually occur during the first 2 years, 12 after submerge. However, of the third of the episode take place between 5 and 20 years later.
Welcome and thank you for joining me. I'm Jerry Oginski, a New York medical malpractice and personal injury trial lawyer practicing law here in the state of New York. Today's video answers a question: what is sepsis? Sepsis is an infection that spreads throughout your entire body. Well, how do you treat it? Sepsis sepsis is treated mostly with different types of IV antibiotics. How does it occur? It can occur a number of different ways. You can pick up an infection either through an open wound. Maybe you had surgery, you developed an infection, and now the infection has spread throughout your body. Well, why is it important for you to know? Sepsis is a very serious type of infection because no longer is it localized to one particular area of the body. Let's say you have a sinus infection and it's localized to your sinus. Or maybe you have an open wound. Typically it's isolated to just the wound. But when that infection spreads throughout your body, it means it has gotten into the bloodstream and now literally is infecting and affecting your entire body. Unless it's properly treated, you have a significant risk of literally getting worse and worse. So if a physician fails to timely recognize and treat your infection that runs throughout your body, you may have a significant problem. And if you think you've been the victim of unrecognized sepsis, then I want you to pick up the phone and call because I can answer your legal questions. You can reach me at 516-487-8207 or by email at
Diagnosis means laboratory, the blood smear, and simple and available tests detect the presence of walled fluids, nuclear fragments, being the best clinical evidence of functional impairment of the spleen. Images. In the first approach, the abdominal echograph can be used to document the splenia in turn. The echograph color Doppler and width reading, the amount of blood flow and indirect the regular splenic function.
The spleen is one of the organs in your body that works to clean your blood. The spleen is located behind the stomach and to the left of the liver. Specifically, the spleen picks out and destroys red blood cells that are no longer useful. A splenectomy is the surgical procedure used to permanently remove the spleen from the body. Reasons for removing the spleen vary. Most spleen removal surgery is performed in an emergency situation during which internal bleeding may be putting a patient's life at risk. This program assumes, however, that you are not currently in an emergency setting. In your case, the reason for removing the spleen may be to treat a blood disease, blood congestion, Gaucher's disease, white blood cell deficiency, the growth of a tumor, or the growth of cysts. Occasionally, the spleen is removed as part of an action taken to determine the best course of treatment for Hodgkin's disease.